Is it me, or have politics reached a boiling point lately as the issues of healthcare reform, offshore oil drilling, and pretty much anything to do with government pits us one against another in sometimes ugly ways? I'm Matt Reed, and here to help us make sense of all this are two gentlemen who love to mix it up themselves. That would be Bill Mick, host of Bill Mick Live on WMMBAM Radio here in Brevard County, and John Glisch, editorial page editor here at Florida Today. Thank you for joining me, gentlemen.
Nice to be here.
First up, healthcare. Democratic Senator Max Baucus of Montana unveiled what he thought was a compromise plan for health care reform. Gone was the public option Republicans love to hate. More likely to move forward in Congress, some tort reform, expanded coverage for the uninsured, taxes on the most expensive health plans, and a private insurance exchange that no one really knows how it would work yet. There seems to be little real compromise so far. Republicans have rejected the plan out of hand. Even one of its most reliable sources of campaign money, doctors who belong to the American Medical Association, appear to support some of its key ideas. The AMA's vision for health reform includes health insurance coverage for all Americans, reforming the insurance market to expand choice of affordable coverage and eliminate denials for pre-existing conditions, leaving health care decisions to patients and their physicians, that makes sense, repeal of cuts to Medicare reimbursements, and liability reforms to reduce the cost of defensive medicine. Here's what I want to know, gentlemen. No matter what we seem to propose, we're arguing. The left has its drop-dead things that it wants to see. The right has some things it does not want to see. What I sense is that everybody has something to fear in all of this. What is it that you're seeing or hearing that people fear most about health care reform?
From the conservative side, it would be the mandate. The president addressed a joint session of Congress 2 weeks ago tonight. Let me get this out of the way. You lie! But, and that was a sad situation, but it'll blow over at some point. I thought the first third of the president's address was really good. Mm-hmm. I thought it was well-intentioned. I thought he had some right ideas. And then about a third of the way into it, he hits on a mandate that everybody has to buy insurance at the order of the government. That's where conservatives are going to balk and say, no, that's government overreaching, and it's wrong.
I think David Broder wrote this week that Obama's message has changed somewhat in a significant way, from change you can believe in to change you need not fear. And yet, John, even the left has things about this that they fear will not be passed or will not be changed in all of this. What are you seeing?
I think one thing, the liberals' fear is that the reform, if reform comes to pass, and I still think something will, I'm not sure what at this point, that it won't be strong enough, that it'll just be too weak, and that this kind of unique opportunity perhaps to pass something will go by. I know many liberals still want the public option. I just don't think that's going to happen. I think there's plenty of votes for it in the House. There ain't the votes for it in the Senate.
Right.
And the Senate is where this deal is going to go down in terms of some type of compromise getting crafted that can or cannot pass. I'll add this thought, and I think Bill probably would agree with me on this. If everybody has something to fear in this, whether you're a conservative or whether you're a liberal, it's this, is that in the first 6 months of this year, the health insurance industry has dumped almost $265 million into lobbying. There's 3,300 healthcare industry lobbyists working Capitol Hill as we speak, which is 6 lobbyists for every member of Congress. And I think that ought to tell you something about what's going on out there within the insurance industry, about how much they are trying to control this debate. I think how much of it's been fabricated by some of their AstroTurf groups, and just everything that they're doing to weaken this as much as possible, or even try to kill it.
Big part of the problem there is that government has trained big business in this country that if you're going to have your way in government, you're going to have to lobby your way in, and you've got to weigh in on every battle, or you're going to have something that harms your business along the way. I understand John's concerned about lobbyists on this issue. I'm concerned about lobbyists on every issue. That's why you're seeing some of the revolt you're seeing in the country from conservatives and independents and Democrats too over the way government's operating.
I have a slightly different take on the insurance issue there based on what we've experienced here in Florida, and that is if they require people to buy insurance, but then there isn't some other outlet there that give consumers an affordable choice, then what you have is a captive market, as we have with homeowners insurance in Florida, workers' comp insurance in Florida, in which there's there's government-induced demand, but not some other mechanism to reduce the cost for the people who get in there to buy the insurance.
That's an interesting example. Look at government-run homeowners insurance in the state of Florida. Citizens is not the place you want to be, and the state's almost bankrupt because of it. We're one hurricane away from major financial problems in the state, like we haven't had some already.
Is there anything that people seem to want in common in all of this?
How about sanity?
Good luck.
For one thing.
We'll be out of work, John.
That's true. You know, I think there are some people that simply don't want to see this happen, period. And I think that certainly the Republican leaders in Congress had indicated that. You know, they want to use this as Obama's Waterloo, as they've said, which is why you're seeing absolutely, no matter what is proposed, they're against. I really think that there's a majority of Americans out there that want to see something passed that addresses a lot of key issues. And that is some of the thing where there is actually a lot of agreement out there between Republicans and Democrats on the Hill, which are issues like, mandating that everyone can get insurance in some way. I think there's a lot of agreement on that. The question is how. You can't be dropped for pre-existing conditions. You know, there's a lot of these kinds of things that people really want. And I think part of it is too is people who have insurance, which is the majority of Americans through their employers, they really want to see those premiums go down somehow because they're getting killed by them.
Well, they talk about the co-ops,
yeah,
right? And where those have been tried, or where individual consumers or consumer groups have tried those in the country. One example in New York, where there was a doctor who was working to deal with his patients. You're going to pay me $60, $70 a month. Whether you come to see me or not that month, I get the 60 or 70 bucks. But you come and see me as many times as you want. The state of New York deemed that an insurance program and told them it was illegal when it was working for both the doctor and the patient. We need to get some government out of the way here and let the market work a little bit too.
Good point. My take is that nearly everyone agrees that we need to reform the soaring cost of health care. Here's what Health First CEO Mike Means told a group of employees at a recent town hall meeting at his Brevard County company.
I think that most people in our industry and the public in general would recognize that our healthcare system, as good as it is and as complete as it is and as many wonderful things as we accomplish, we've got certainly room for improvement. And one of the issues that is going to be at the forefront of the debate is going to be the coverage issue. We have arguably between 40 and 50 million probably people in this country who currently do not have any type of health insurance coverage. That's a large number. It's more than any other country in the Western world that we know, and it's something that I think many people across the country feel embarrassed or ashamed about because they think we can do better.
Note, the health care bills in the Senate and House would prevent federal funds from being used to pay for abortions except in cases of rape, incest, or the life of the mother. It would leave in place state laws that protect health care workers who refuse to participate in abortion coverage. However, that remains a topic of debate. Next up, drilling for oil off the coast of Florida. This is a big topic. I understand we may be looking at some kind of a bill coming up in a special session. John, what's on the table now?
Well, pretty much the oil industry is doing everything they possibly can to ram through a law that would allow for drilling in nearshore waters, which has been banned for 20 to 30 years and has had long-standing bipartisan opposition from governors and members of the legislature. They want to try to get it done in a special session next month. I don't think that's going to happen at this point. And they're lining things up, if that doesn't work, to get it done in the regular session that starts in March of 2010. And I think there's a good chance they're going to get it done. And I think they're going to get it done for a lot of the wrong reasons. When I look at this whole argument over oil drilling in Florida, I'm always reminded of that great American philosopher P.T. Barnum, one of my favorites, who said there's a sucker born every minute. And I really think a lot of what's going on here is a real sucker play by the oil industry to the people of Florida. They're making a lot of great promises, and there's absolutely no way to know if any of this is going to come true. $2.3 billion they're saying a year in royalties that the state could use to help fund programs at some point down the road. That's from a study they've ginned up. There's been no independent analysis of that. The whole issue of how many jobs would actually be created in Florida, there's been no hard independent numbers that have been proffered for that at all. There's one big bottom line, I think, with drilling, and it's this, is it worth the risk? I mean, Florida's tourism economy is about $65 billion a year. And while there would be areas off the Gulf Coast where they would not apparently be allowed to drill, or so they say, and I'm not necessarily sure I buy that at this point, is it worth taking that risk of some type of spill and just the other associated pollution that you get from drilling from the wells and the onshore facilities? There's been a lot of attention during this whole debate to a big spill going on off the coast of Australia that is pumping, I'm not sure how many millions of gallons, but quite a lot. And it happened in a rig. It's the same type of equipment that they would be using off the coast of Florida. And it's also important to remember, I think, too, that with hurricanes, is that Katrina and Rita in the Gulf, total spills there were over 9 million gallons.
I think it's ill-advised to try to put this into a special session. You only want a special session for something that's urgent for the state to deal with. This is not an urgent issue for the fall. Take it back up in the regular session. Matt, you and I talked last week on my show with Dave Rancourt. He's with the Southern Strategy Group. It's the lobbying group that's trying to push this through. And he did throw out those numbers about jobs. And he also told us, though, that this oil is going to be piped directly to Louisiana or other places along the Gulf Coast where they already have the refining facilities. Part of the law here is that they'll have to bury a pipeline under the ocean that's going to take this oil directly from where it's being drilled, where they're recovering it, directly to the onshore facility. Doesn't involve a ship, doesn't involve those kind of things. So I think there's some things that are worth looking at here, and drill, baby, drill. Let's go.
One last thing I'll just throw in here. The study that was done by the Bush administration, the pro-drill, the drill, baby, drill, presidents and oil industry guy, vice presidents and oil industry guy, that was done by the Department of Energy under the Bush administration, said very explicitly that if you opened up all the rest of the continental shelf of the United States to drill, that's now off limits, it would not have any significant impact in any way in terms of more oil for the United States. The oil all goes to the international market. Where it's like all the Alaska oil does, and that also that whatever you drill off Florida, because of it, all that oil goes in the international market, it's not going to have any impact at all beyond maybe a penny or two at some point long down the road at gas at the pump. So the whole pitch that if we do this, the oil's going to come to Florida and we're going to be paying less at the price at the pump, it's all nonsense.
And yet, some 70% of Floridians say that they are open to it or want it. They're just concerned about where the rigs would be. I think so, only about 30% said anywhere. Most people said, I have some concerns about that. And this is one of those areas where public opinion really is fueling the movement to go, sort of legitimizing the potential special session that they're talking about happening to bring this up. Where's that coming from, Bill, that people are saying the drill, baby, drill?
They're tired of having their wallets drilled into by this state legislature in the form of new taxes and fees. Take a look at what happened in the last legislative session. You've got a new cigarette tax, you've got new fees, you might as well call them taxes on traffic fines, you've got new fees for your license plates. Everything has gone up. The cost of doing business with and in the state has gone up. What they really need to work on is creating a positive business environment in the state of Florida. There are places like California where you could draw a lot of business to this state that would be done here and bring jobs here if they would just make a better business environment, and part of those prohibitive taxes are the problem.
There are going to be some people who are really, really for it, some people who are really, really against it, and I think there's going to be a bunch of people in the middle sort of scratching their head about what does this mean to me here in Brevard County. We'll have more as we continue with that debate. Bill, speaking of public debate, you recently hosted an event in connection with the 9/12 national I guess protest against everything. Tell us about what happened.
Yeah, it's protest against everything just because we like to protest. No, back in March, Glenn Beck, one of our hosts on the station and host on Fox News on television, had created the 9/12 Project. And the idea was the day after September 11th, this country was united. And very shortly thereafter, I'm calling it about February of 2002, we started a bigger political divide than we'd seen in the country. And it was pretty well divided before then, but it was even worse. And the rancor was just, it was terrible. And Glenn started talking about, what about the day after September 11th? What were we like then? Everybody had a flag in hand. Everybody was united in this country. And we came together and said, you know what? We're not going to put up with these kind of attacks on our country. We need to be a united States of America again. That's the idea. This is being falsely portrayed as a tax protest, although taxes are part of the problem. It's not partisan, and it's not racist or Obama related. It's a frustration with government. The government is trying to do too much, too fast, too many taxes, too much spending money we don't have, and people are tired of their government not listening to them. And that's what the March on D.C. was about, and that's what the 500 people we had at the Mighty Mushroom in West Melbourne that day was about too.
Anytime you have a real economic crisis, which is what we're still in now, with high unemployment and the foreclosures and everything that's going with it, people get understandably afraid. And when you start talking about government intervention in a way to make significant changes in segments of the economy and things that are important in people's everyday lives, like health care, people get more afraid. I think, in my view, there's a couple things going on with the rallies. One of them, I think Bill's right. There's a lot of angry people out there about a lot of things. And I think a lot of the Tea Party people and a lot of the other folks, I think they have a lot of legitimate grievances in that they don't like the way government's going, they don't like the idea of maybe what might happen in health care.
Sure, First Amendment stuff.
Sure, there's all that kind of stuff that's going on. But I do think if we're really going to be honest with ourselves, that there is an undercurrent, and sometimes it's a strong one, of racism that's involved in this.
I disagree wholeheartedly.
Okay, let me finish. I don't think that you can look at the signs that some folks, not everybody, but some folks have been holding up that the president's a monkey, that he's a gorilla, that he's a witch doctor. Those are clearly vile racist symbols.
Where are those signs? I haven't seen them.
Well, they've been all over TV and all over the web. Let me finish. And I think if you look at that within the context of some other aspects of what's going on out there in the country, particularly the birther movement, where some of the polls have just shown crazy numbers. We've got some here that some of the polls that have indicated as much as 55% of registered Republicans and conservatives don't believe or are convinced that the president is not a United States citizen, wasn't born in America, or aren't sure. There was a poll that was done just in the last week and a half out of North Carolina that showed as many as 76% of people who call themselves conservatives believe that. I don't think you can look at that and not say that there's something that's not else, that something else isn't going on out there beyond all the anger against government. I really believe that if the President of the United States right now was a white guy whose name was John Smith, who was born in Hawaii, you wouldn't be seeing these kinds of numbers like we're seeing with the birthers. You certainly wouldn't be seeing people holding up signs of depicting the president as a monkey, as a gorilla, or a witch doctor. And that's what really concerns me.
Now, whether the president was born in this country or not, it doesn't matter. He's the president. And Bill Posey said as much in what's been labeled his birther bill. His whole idea behind that bill is to make sure these questions don't ever come up again. Just have everybody produce the documents up front, no questions asked, they're both eligible, elect one of them, and here we go. Bill Posey said, the president's the president, that's not going to change. I agree with that. But when you go to the racism thing, if you're talking about people that you associate yourself with, look at Van Jones. Let's look at the guy from Chicago who was the terrorist that was blowing stuff up. Let's look at the people Barack Obama's associated with, and it's not racism that is the problem here. It's the problem of his associates and what he wants to do with this country that have these people so afraid.
I don't think that Jimmy Carter was right when he said that the overwhelming majority, I think those were his words, of the folks that are involved in this are inherently racist. I don't think that's the case at all. But I really do strongly believe that there is an undercurrent out there, and I think it's a pretty strong undercurrent in many respects, that there is a racial element involved in this. And I think it's imperative that everyone stand up and say, this has no place. This has no place in our country.
The funny thing about President Carter is he was born in a racist Georgia back in the 20s, 30s is when he was born. Raised in the 40s, 50s, became president in the 70s. I think he's projecting his upbringing on the rest of the country. And I said that on the show the other day. Mr. President, stop it. Don't tell me that I feel the way you do because I was not raised the way you were. And if he projects that on the rest of us, I think that's pretty much unfair. We're in a different United States today. We have a black man as president of the United States, and those of you who argue that he's only half black, doesn't matter. He identifies as black, that's where he is. I'm fine with that. And it's not the color of the president's skin that's a problem, it's the policies that he's pursuing and the direction he's taking them that have at least most of my audience upset.
Well, I think we're out of time, gentlemen. I want to
for
thank
about 10
you
minutes.
both. I want to thank you both for coming in and sharing your ideas. That's our program. I'm Matt